Professor van Zandwijk, Nico, welcome back to Europe from down under. It's 20 years since we worked together in the Netherlands Cancer Institute and in the ELCC Lung Cancer Cooperative Group. And now you've taken on a new challenge in Sydney. Tell us about it.
New challenge in Australia. Basically, asbestos is an enormous problem in Australia. There is a high exposure per capita, and that leads to mesothelioma, lung cancer, and the dust, the fibrotic reactions. And basically, I was asked 2 years ago to come to Australia and to head a new institution which was primarily devoted to those asbestos-related diseases. And currently, we have started research, and we are starting clinical trials regarding asbestos-related disease. And I think our focus is mainly in the lab, and we try from the lab to be as much as translational as possible. Building a tissue bank, looking at the targets for potential targets for treatment.
Nico, there is an epidemic sitting waiting to happen in Europe, but also in down under where you are. A lot of the research has inevitably been looking at end-stage mesothelioma, when frankly it's often too late to do very much. Have you got research lines running on interrupting the pathogenesis from the asbestos through to the mesothelioma? What do you think about that?
Yes, that is an important issue. Most diagnoses are made in late stage, and finding, for instance, an actual biomarker for helping, for assisting to make an earlier diagnosis is important. There is currently a new development in the microRNA area. We are also active in that type of research. Obviously, that needs a lot of validation. But there are many other targets. RNA interference is closely related to that, obviously. Regarding the actual situation, I think that also in a country like Australia, and that has also been done in Europe, we need guidelines for the treatment, because obviously it is a disease which is not seldom anymore, but it should be treated in centralized settings. Multidisciplinary teams should be involved, so guidelines are important, and we should focus also on prognostic and predictive factors.
And clinical trials.
Yes, clinical trials. If we're looking at individual predictive factors, for instance, for chemotherapy. Recently, Giorgio Scagliotti has published about TIMS expression. Obviously, that's an important sign that individualization of therapy will also take place in mesothelioma, and we would like to upfront select patients who will benefit from treatment.
And the political battle, is it won? No problems any longer. The politicians understand the issue about asbestos and the terrible consequences.
Yeah, politicians understand the situation very well in Australia, and actually my institution was opened by Kevin Rudd. Good sign, and we are now focusing also on the neighboring countries, because the time bomb in Asia is tremendous. India is using unregulated asbestos in a large scale. Whole Southeast Asia is affected, and obviously one of the major problems is the lag time of the disease is about 40 years, so there is a lot to come.
Sure. I mean, it's easy with volcanic ash. You just stop things, it's done, it's acute, and then it's over. But when you've taken in this asbestos stuff in, you're waiting a long time, and you're knowing that you're at risk.
Yes.
And that's a big issue too.
That's a big issue. That's a big psychological issue, and that's also worthwhile investigating. The important point there is that we see in Australia also more environmental exposures. So there is so much asbestos in the Australian environment that it might well be that we'll have to consider a change in epidemiology, because the diseases were first purely confined to certain occupations, but not anymore. Females are increasing, and a similar pattern is maybe expected in the developing countries.
Sure. Lovely to see you back in Europe, Nico, and good luck in Sydney. Thank you very much.
Thank you.